Hello people, in this video we want to look at anti-rabies vaccine. It may simply be called as rabies vaccine also. This is very important for the exam. So please pay attention here. The question can come as rabies vaccine or anti-rabies vaccine or immunoprophylaxis of rabies. Okay. Or it can come as non-neural vaccines of rabies. Okay. So Louis Pasteur was the person who discovered this rabies vaccine, correct? Okay, pay attention here. Now let's move on. First of all, what is this rabies caused by? Rabies disease is caused by virus. It's rabies virus itself. So rabies virus is actually RNA virus. In this classification video, we have already covered all this. Remember this rabies virus comes here. It's a rhabdovirus. It's an RNA virus, arbovirus, rhabdovirus, rabies virus. So if you want to remember where it comes, it's an RNA virus, arbovirus, rhabdovirus, then comes rabies virus. It has single-stranded RNA. You can see negative sense, single-stranded RNA, and it is bullet-shaped. You can see this is actually quite a big virus, okay? So it is bullet-shaped. So rabies virus is bullet-shaped, RNA virus, single-stranded RNA virus, it is rhabdovirus coming under arbovirus, okay. Now, actually, if the foxes, right, then dogs, these get infected very easily with rabies virus. So, it spreads to human by, most often by bites, okay. So, obviously dogs, because they are more around us. So, the problem here with rabies is if the person gets infected, then the mortality rate is 100%. Okay. There is no cure to rabies. The thing is, if a person gets bite and he is he's got infected with rabies, then the only thing that can be done is symptomatic relief can be given, like sedative, anti-anxiety, pain relief like from morphine, hydration. All this can be done for the person. But as such, there is no cure. The person who is infected, mortality rate is almost 100%. But the thing is that the prevention is possible. That is, once there is, exposure, that is post-exposure, that is, there is a bite, then if therapy is given in early incubation period, then prevention of this infection can be done. You understood, right? So if there's a dog bite, they will immediately give the immunoprophylaxis to prevent the infection. But if that infection happens, then the mortality is almost 100%. So, how exactly you can prevent? Prevention can happen at the dog level, stray management, animal birth control, mass immunization for the dogs, okay, not for us. And usually for dogs, at 3 to 4 months age itself, they will start these vaccines and then they'll give booster doses. These are the vaccines that are given to dogs. Okay, so let's move on. The thing with currently, at least in the situation here, the problem from dogs is not rabies. The problem is the dogs actually are killing children. They're attacking children, they are killing children, and the government is actually not doing anything for animal birth control. So, probably there is no money devoted to animal birth control, or all the money is not used properly. So the current problem is actually stray dog, they chase vehicles, they kill children. So it has become a bigger problem than rabies. Now, why no vaccine before the bite itself? So this is something that you are thinking, right? Why don't they give me the vaccine before the animal bites itself? Why are they giving me a vaccine after the animal bites? Yes. So basically, to understand that, you should understand that there is pre-exposure prophylaxis. It is available, but this is given only to high-risk people like lab staff or veterinary doctors or animal handlers or some people like that who are very prone probably to get a rabies infection. To those people, pre-exposure prophylaxis is given. So here they will give 3 doses for pre-exposure prophylaxis. You can go through that. IM you can give, or ID, that is intradermal, right? So basically here what happens, they have to check the titer, and if the titer falls below this level, they'll have to give booster dose, okay? So every 2 years they have to take a booster or something. So it is possible to have pre-exposure prophylaxis. But why they're not giving all the public this because, first of all, there is incubation period of the rabies virus. So once you are attacked, you can take the vaccine, and once the bite happens, the incubation period, the time is available for giving the vaccine. So that is why probably no vaccine before the bite. To us at least. But for people who handle animals, veterinary doctors, they can take a pre-exposure prophylaxis 3 doses. Okay. Now, risk categorization and recommended anti-rabies prophylaxis. There is 3 categories: category 1, category 2 and category 3. So just note this: category 1, category 2 and category 3. Category 1 is no risk, like touching an animal, feeding an animal, if the animal licks. If the history of the dog looks fine, then no treatment is required. So it's normal day-to-day life with pets, right? No risk. Category 1. Look at category 2. In category 2, what happens? There's minor risk, okay? It's a scratch or an abrasion, but it's not actually a bite, okay? Not actual bite. There is no bleeding, right? There is no bleeding here. So basically here, same thing, wound management, rabies vaccine is given and you have to observe the dog for 10 days. But this is not possible. We have at least here where I live, we don't know from where the dog came, where the dog went. Everyday life is like this for us. Well, I'm an animal lover but the government doesn't seem to do anything about animal birth control. Coming to category 3, it's a major risk. Major risk here, there are multiple bites. Okay, hold on. So multiple bites are there with oozing of blood. Okay, there is oozing of blood. So this is important. There is oozing of blood. Okay, and there could be licks on open wound. So you already have an open wound and there is a lick on this open wound or mucous membrane. Okay, and there is a bite by wild animals. If there is a bite by wild animals, okay, that also becomes a major risk. Okay, so you already had a wound which the dog licked. Okay, licks on wound. You can't see this color. Licks on wounds and bite by wild animals. All these become the major risk category. Okay, here what you will do, you will give same wound management. Here you will give rabies, immunoglobulin also. Immunoglobulins are also given and vaccine is also given. Immunoglobulin will be faster, right? It will neutralize the rabies virus, correct? And then the rabies vaccine is given and observe the dog for 10 days. Only 10 days they are observing the dog. Okay, if the animal looks healthy, then you can discontinue the vaccine. Note that any animal bite, they will give post-exposure prophylaxis in India, except rat. Any animal like a bat or whatever you say, cat, anything, okay? They will give post-exposure prophylaxis in India. Okay, so currently where we are, we have seen rabies introduction, we saw why it is not given beforehand, the vaccination. And we have seen the categories, category 1 no risk, category 2 minor risk, category 3 major risk. Immunoglobulins are given in category 3, right? Now let us go to what happens. Now a bite has happened. Now what exactly has to be done, right? Local wound care. So physical cleaning has to be done. Chemical inactivation, neutralization biologically, then tetanus prophylaxis, antibiotics, etc. So basically the wound has to be washed thoroughly with soap and water. And it should be irrigated by catheters, okay? Soap, water, irrigation can be done. Then chemical inactivation. Here antiseptics like iodine or povidone, alcohol, okay? So you will use antiseptics like povidone, iodine, alcohol, etc. Okay? Then biological neutralization, how you can do with immunoglobulins. So what they will do, they will give rabies immunoglobulins at the site of wound, right? At the local site they will give the immunoglobulins and also they will inject IM. So they should give it where? Locally and IM. Then the devitalized tissues should be debrided. Coming to the tetanus prophylaxis, you should give a tetanus prophylaxis. So you're trying to prevent tetanus also. So Clostridium tetani infection also will be prevented. Antibiotic we will give it to prevent bacterial infection. And this is something you should know for dog bite, you should not cover the wound. Because if you cover the wound, you will be pushing the virus to deeper location. Okay, you should not suture. It's contraindicated. Suture ring of dog bite, contraindicated. It will push virus deep. That's why. Okay, what will push? Suture will push virus deep. That's why they don't suture. Okay. Now let us look at the vaccines available for giving. Actually, these are immunoglobulins. Hold on. What immunoglobulins are available? Let's look at that. So this is passive immunization, rabies immunoglobulins, right? This is passive immunization. So you are giving the ready-made antibodies to the person. What options you have available here? Equine rabies immunoglobulin and human rabies immunoglobulin. ERIG and HRIG. ERIG, HRIG. We can say ERIG and HRIG, correct? So these are given where? Around the wound and also intramuscular. See, these are ready-made antibodies, correct? So they are passive. So they are given around the wound, okay, locally they are given and also intramuscularly. They bind with the rabies virus and neutralize that. So this is biological neutralization. Okay, there are two types of RIGs available. Equine rabies immunoglobulin. This is from horse, right? So there is a lot of side effects with this. So side effects are more like serum sickness. And then you have the human rabies immunoglobulin. These are good. They are from, I don't know from where they are, but they are devoid of side effects. Okay, not much side effects. So we are done with rabies immunoglobulins. How many people are sleeping? Wake up, guys. What we have seen so far? Tell. We have seen categories of risk. We saw the immunoglobulins. That is the passive immunization available for rabies. Usually it is given in category 3, major risk. Correct? Okay. Now let us move on to the active vaccination. So these are the rabies vaccines. Okay. Active vaccination. So here actually let's say a dog has bitten and now you want to give them some vaccine. Okay. So basically here you have two types, neural vaccine and non-neural vaccines. What is currently in use are the non-neural vaccines. Okay. So non-neural vaccines, in that what is actually used, these are cell culture derived vaccine. In that you have chick embryo, varicocele and human diploid cell vaccine. These three are actually used. You need to know these three names. Are you awake? What are the three that we are going to actually use? The non-neural ones. In that the cell culture one, correct? So we have from the chick embryo, from the varicocele and human diploid cell. Okay, three things available. Now let us look at the details of these three because it might become too much if you know the others. Neural vaccine, actually Louis Pasteur gave the neural vaccines. But these are not used anymore. You have example like Sempill vaccine, BPL vaccine, that is beta propiolactone vaccine, infant mouse brain vaccine. These are neural vaccines not used. Then you have the non-neural vaccines. You have the egg-derived vaccine. These are not used again. Then you have recombinant viral vaccine. This is still in experimental stage, so not used. You can say cell culture derived vaccine. Basically, this is the most recommended vaccine for prevention of rabies. They are highly immunogenic and they are devoid of neurological complications. So that's why these are used. Three vaccines are available in India. Those are purified chick embryo cell, that is PCEC vaccine. It is prepared from the chicken fibroblast cell. This is prepared from what? Chicken fibroblast cell line. From chicken fibroblast fibroblast cell line. And then coming to purified Virocell, PVC. PVC is not that pipe, okay. PVC is vaccine. It is a purified Virocell vaccine. It is prepared from Virocell line. Do you know what Virocell line is? Actually, according to internet, these are from the monkey kidney cells, okay. Then human diploid vaccine, it is derived from WI38, that is human embryonic lung fibroblast cell line, okay. This is from WI38. WI38. This is human embryonic lung fibroblast cell line. I wonder how they make it. If you know information, do let us know. So basically, these are the actual vaccines in use for rabies. How many people are sleeping? Okay, so what are we studying now? We finished the actual rabies vaccines, you know. The ones that are actually used, do you know their names? Tell their names. PCEC, PVC, HDC. Wow. PCEC, PVC, HDC. Say these three.
Cell culture derived vaccine for rabies. PCEC, purified chick embryo cell vaccine. PVC, purified Vero cell vaccine. HDC, human diploid cell vaccine.
Thank you so much. So guys, shall we move on? Are you ready? Okay. So here we are. Let's look at the regimen for post-exposure prophylaxis. How many injections have to be given? Mainly intramuscular, remember. So it is given to the deltoid region because fat is less there. Gluteal region will have more fat, so they don't prefer gluteal region. So deltoid region is ideal because there is less fat. Okay. So you know where your deltoid is, right? Shoulder. Okay. So this is IM regimen. IM regimen means intramuscular route. Okay, this is also called as Essen regimen. Here that will give 5 doses. That's why 5 injections have been put here. 1, 2, 3, 4, 5. So on the first day you will give 0. First day is called as 0. So that is the first dose. Then third day, then 7th day, 14th day, 28th day. Look at this. 7 1s are 7, 7 2s are 14, 7 3s are 21, huh? 7 4s are 28. Oh, how did they do this then? Okay. So 3, 7, 14, 28. Fine. 3, 7, 14, 28. So 0, 3, 7, 14, 28. 5 doses are required intramuscular. So every dose will be like 0.5 or 1 ml only. So small, 0.5 or 1 ml is given. Okay. 0 day, 7th day, 14th day, 28th day. 0 day is the day of the first injection. It is not the day of the dog bite or whatever. The day you get the first injection is the first 0. Okay, 0th day it is first dose. Okay. So, then the gluteal region is not recommended. We already told you. For infants and young children, anterolateral part of the thigh. So for children it is not the deltoid that they are saying. For children it is anterolateral part of the thigh. Okay. Now there is an intradermal regimen available. This has only 4 doses. Are you paying attention? This has only 4 doses, guys. Look at this intradermal regimen. This has 4 doses. Just remember 4 doses. 3, 7, 0, 3, 7 and 28. There's no 14. Okay. Just like 13 is unlucky. Here 14 is unlucky for them. Here they have kept only 4 doses, 14th is not there. Okay, 0, 3, 7, 28 if it is intradermal. Moving on, guys. So if a person was previously vaccinated and then, you know, that person got a dog bite. So there is, what is the post-exposure prophylaxis that you will give for a previously vaccinated individual? So what happens if he was previously vaccinated? To that guy, you will again give severity based on the severity of the wound bite. You will give 3 doses, 0, 3 and 7. Okay, go with this much. This much is enough for now, I think. Immunoglobulins are not needed, they are saying. Okay, immunoglobulins are not needed. Just give them the vaccine on 0, 3 and 7th day. Okay, that's all. Wow. So we have finished a rabies vaccine. So this question is very important for the exam, guys. So just pay attention here. So bullet-shaped virus, a rabies virus. It is an RNA virus. Okay. Mainly infects foxes, dogs, cats, sheep, anything you say. And if a person gets infected, mortality rate is 100%, but there is prevention. So you can either take, prevention, pre-exposure prophylaxis or post-exposure prophylaxis. Usually, pre-exposure prophylaxis is given to veterinary doctors, animal handlers, etc., even lab technicians. Okay, here what do they give? They give 3 doses. See, 3 doses only they are giving for a lot of people. 3 doses. Okay. Can't remember everything. Just remember 3 doses for pre-exposure prophylaxis. Categories you should know. Category 1, Category 2, Category 3 is major risk where there is a bite and there is oozing of blood. Here you will have to give immunoglobulins along with vaccine. Local wound care you should mention once there is a dog bite. You have to clean it physically, chemically, biologically. Tetanus prophylaxis, antibodies, antibiotics you should give. And don't do any suturing. Passive immunization, guys, immunoglobulins, you will give it in, when will you give this? In category 3. That is major risk. In major risk only you will give this. Right? Around the wound and also iron. So you should know the names. Names we didn't tell you. E-rig and H-rig. E-rig and H-rig are rabies immunoglobulins, equine rabies immunoglobulin from horse, but it causes serum sickness. Human rabies immunoglobulin, not much side effect. So human rabies, H-rig you remember from this video. Let us see H-rig. Let us just make some keywords that we have learned from this video. H-rig. Coming to active vaccination, here you have neural and non-neural. Neural is actually what Louis Pasteur found. What exactly do you mean by neural, you know? Neural are actually derived from the nervous tissue of animals infected with the rabies virus. So basically from the nervous tissue they are derived, okay? But they cause neurologic complications, okay? Hence they are not used. Examples for neural vaccines are Semple vaccine, okay? Then BPL, then infant mouse brain vaccine. We are not going into details of these, they are not used. Non-neural vaccines, you have egg-derived vaccines like some things not used now. Recombinant viral vaccines still in experimental stage. What exactly used? PCEC, PVC, HDC. Okay. PCEC, PVC and HDC. Okay. Then so you will give IM 5 doses. This is called as Essen regime 0, 3, 7, 14, 18. 0 refers to the first day of the injection. Deltoid is preferred because fat is less. Because fat retards the absorption. So they don't give it to the gluteal region. For children, anterolateral part of the thigh. Okay, anterolateral part of the thigh is preferred. There's an ID regime. For ID regimen, this has only 4 doses. They don't like 14. So 0, 3, 7, 28. Okay, if a person was previously vaccinated and then he got a dog bite, then just by giving 3 doses of vaccine, it should be sufficient. They don't give immunoglobulins. That's all. Hope you enjoyed this video. Take care. Bye-bye.